Isabella Sullier, SPCE 680, Dr. Bryce E. Taylor. It's November 4th, 2024. Everything the person is currently capable of. Repertoire. Pretend play, often called imaginative, symbolic, or dramatic play, involves children using their imagination to create scenes, roles, and narratives that may not involve real objects or actions. Imaginative play includes a determination of whether the resource and supports that are required for the intervention to be implemented are present in the situation. Feasibility. Communication system based on applied behavior analysis that uses pictures to help people with communication difficulties. Picture exchange communication system. When one person purposely coordinates his or her focus of attention with that of another person, joint attention. A chemical compound used to treat or cure illness. Medication. Neurological and developmental disorder characterized by social communication skill deficits in the presence of restrictive, repetitive patterns of behavior, uses objects or speech. Autism spectrum disorder. A standardized interview that helps diagnose autism spectrum disorder in children and adults. Autism diagnostic interview. A broad category of behaviors that are characterized by a strong preference for sameness and frequent repetition of actions. Restrictive and repetitive behaviors. Behaviors that inflict harm on person emitting the behavior. Self-injurious behaviors. Behavior analysts refer and document the referral for their clients if they suspect that medical or biological variables impact client behavior, considering medical needs. Short, perspective, or prescriptive descriptions of a particular situation or event or activity which involves specific information about what to expect in that situation and why. Social stories. This property represents the elapsed time of response or how long. Temporal extent. Antecedent behavior consequence used to study and understand why behavior occurs. Three-term contingency occurs when a model invokes a physical response, which is topography identical. Motor imitation. Conditions that are often likely to co-occur. Comorbid conditions. American Psychiatric Association's professional reference book used to aid diagnosis of mental health and brain-related conditions. Diagnostic Statistical Manual of Mental Disorders. A brain disease where nerve cells don't signal properly, which causes seizures. Epilepsy. The range of differences in individual brain function and behavioral traits regarded as part of normal variations in the human population. Neurodiversity. A standardized system used to code diseases and medical conditions. Statistical Manual of Diseases. A range of strategies used in the process of determining motivation for an individual engaging in significant behaviors, disruption, and how the behavior relates to environment. Functional behavioral assessment. Structured method utilized to identify highly preferred items or actions that can be used as reinforcers to keep motivation levels high when teaching. Preference assessment. How long a behavior occurs. Duration. Typically includes an analysis of quality, quantity, and consistency of the literature related to either the effectiveness of one treatment across populations or the effectiveness of any treatment for one given population. Systematic review. Stands for Say All, Fast, Minute, Everyday Shuffle, the behavioral instructional methodology. The use of flashcards to help people develop fluency in a behavior. SAFMEDS. Behavior in which an individual's free time and conversation is dominated by their special interests or obsessions. Ritualistic behavior. Inability to perform purposeful actions such as simple movement or speech. Apraxia. A way of describing behavior by its topography in order to ensure that two different observers can identify the same behavior. Operational definition. The time between the onset of some environmental event and the target response. Latency. The ingestion of inedible objects. Pica. The involuntary repetition of words or phrases that someone else says. Echolalia. Extent to which a treatment is fair, reasonable, appropriate, intrusive, and likely to be recommended to others. Treatment acceptability. Behavior shaped without directly contacting contingencies, using rules in an efficient method for changing behavior, as it does not require applying reinforcing or punishing consequences consistently over time in order to establish contingencies. Rule govern behavior. The number of new cases per person year. Incidents. Determining what the cause of the behavior actually is. Pass. A change in behavior. Learning. Subjective attitudes, feelings, and other constructs that attempt to use internal factors to explain behavior. Mentalism. research method where a small number of participants are evaluated under carefully controlled conditions and to monitor behavior over time. Single case design. Behavior analysts collaborate with others to improve the services of their clients and compromise when faced with conflict. Collaborating with colleagues includes all forms of communication that are used to express thoughts, needs, wants, and ideas. Augmented and alternative communication. Person's condition with regard to their psychological and emotional well-being. It should inform behavior analytic treatment and referrals to other providers. Mental health. This property represents when the behavior occurs with latency as the measure. Temporal locus. The process of differentiating between two or more conditions which share similar signs or symptoms. Differential diagnosis. Standardized observational assessment tool that helps diagnose autism spectrum disorder to children and adults. Autism diagnostic observational scale. Behavior maintained by consequence. Operant behavior. Behavior analysts collect, represent, or analyze data accurately to make decisions about the client's care. Collecting and using data. Comprised of the following: identify best source of scientific evidence, review relevant client variable, review stakeholder and leader variables, discussion of treatment options, and implementation planning and monitoring treatment selection process. A means of assessing the validity of theory regarding the cause of a disorder based on the fact that cause always precedes effect. Primary criterion. Represent a description of the literature by a professional qualified to examine the research base. Users are more prone to bias due to a lack of transparency. Narrative reveal. Solicit support from others and create a natural context for the behavior. Social support. The proportion of a population found to have a particular condition at a specific time. Prevalence. The number of responses per unit of time or frequency divided by unit of time. Rate. Behavior analysts infuse diversity-related training in their supervision, addressing diversity. Individuals who receive treatment. Target client. The set of observable characteristics of an individual resulting from the interaction of his genotype with the environment. Phenotype. Disability that affects the acquisition of knowledge and skills characterized by subaverage IQ, deficits in adaptive skill functioning, intellectual disability. An observable and measurable action or behavior. Response represents the accuracy with which the intervention or dependent variable is implemented. Treatment integrity. The overall count of a specific bit of behavior, the number of times the behavior occurs. Frequency. A mental health condition in which the person is unable to speak in certain social situations, often attributed to fear or anxiety. Selective mutism.